Doctors of Reddit, what do patients do that annoy you? Story 1. My partner is a doctor. She had two answers. First, the doorknob comment come for a 15-minute appointment. Spend 14 minutes talking about a mild cough. Then as she goes to leave the room, patient suddenly remembers, oh, yeah, and my penis is green and smells strange. Second, having to write medical certificates letter for employers that require them if someone takes a day off because they're sick. Waste of everyone's time. Patient stated he has a cold. Examined and determined that patient does indeed have a cold. Thanks for wasting my time. Story 2. When patients tell me I've got a really high pain threshold during the history, and then act like they're being axe murdered when I take blood or put in 4-line. Story 3. Animal doctor here. I hate when clients bring in their pets for a sick exam and decline all diagnostics and treatments. It's one thing if they're financially in a rough spot. I try to help them out as much as I can. But it's another when they say things like, I just don't believe in medicine, or I think I can fix this with coconut ultramaris essential oils crystals, and I don't trust any of your advice. I feel like I've done nothing to help their little friend, and I worry about their pet all day. Bonus anger when they want to pay for a toenail trim for $20, and the medicine they've declined is cheaper than that I've even gotten no's when I try to give them a free trim so that I could send home meds. Story 4. Med student, but usually something along the lines of, are you smoker? Nope. Have you ever smoked? Yes. How long were you smoking for? -2 packs a day. For 50 years. When did you give up? 3 days ago. Story 5. ID say the general belief many patients have nowadays that pain is never okay. That being sick and feeling like while your body heals is unacceptable. You broke your ankle. I could do lots of things to help you heal and be in less pain, but it's going to hurt. Being pain-free is impossible. You have the flu. You're going to feel like complete for 5 to 7 days. Feverish, achy, weak, coughing. Frankly, unless you're seriously ill, you shouldn't be contaminating your community. In my waiting room, go to bed. Take Tylenol or ibuprofen, fluids, and wait. Story 6. It is not their fault, but where I came from, we have to see 40, 60 patients in an afternoon. Time is of the essence, and we have nearly 15 minutes to interview, figure out what they have, and tell them what can be done. Because of the time frame, during the interview, we need objective answers, something patients avoid like. We ask when the pain started, and they say, well, I was at Mary's wedding when it started. Thinking, who's Mary? When was it? 28th day, thinking of which month. I have several other patients and don't want to be rude with this one, but I need answers. Story 7. Abusers of emergency medicine. My blood sugar is high. How high? 170. How do you feel? Fine. Have you been taking your metformin? No, because I feel fine. The ones that bug me the most are the people that have a basic URI, the common cold, come to the ED and say something along the lines of, it's been going on a few days when I knew I should come get checked out, and then look at me expecting a pat on the head. No, you didn't do good. You're a moron. Another thing I hate, because I'm officially venting now, how bad is your pain 0 to 10? 0 is no pain, 10 is being on fire while covered in salt and lemons. 10 is they sit there with their phone and eating Cheetos, normal vital signs, no distress. Another one, I hate big tough guy comes and hurt his back working out or something, pulled muscle 1010 of course. X-rays negative, no neurologic deficits, nothing wrong. What can you give me something for pain? Sure, take some Tylenol. That doesn't work for me. 10 minutes later, how can you be discharging me when I am in this much pain? It's easy, Stan, I just printed your papers. I just wish these people could see how much time they're taking away from truly sick people. Also stopping, you're going to hurt sometimes. We're only like 2 generations removed from most of the population doing hard labor where they live with aches and pains all day, every day. Now, a sprained ankle merits some Norco and a reassuring talking to. Ugh. Story 8, not a DR, but when I'm doing history intake, when the patient says it should be in the chart for basic screening questions like, do you have a family history of cancer? Story 9, some of my absolute favorite things to hear as a GP. No, you see, I know my body before diagnosing themselves with the most ridiculously far-fetched affliction they managed to Google. I have a high pain threshold, but before fainting from a hypodermic needle, I never ever run a fever or the opposite. No, really, 36. 5C is a very high fever for me. But don't understand, I need this cold to go away as quick as possible. And that's why I really do need antibiotics, so I'm sorry, that's all right then, my bad. Telephone call at 2:30 in the morning, I can't sleep. Well, neither can I now. And yes, this actually happens. My personal favorite are patients with lower back pain, demanding investigations for their kidney pain. Must be awesome to be able to diagnose yourself. What do you even need me for? And just for shits and giggles. Hey, race, my real absolute favorite thing a patient has ever told me my date of birth. How should I know? I never went to school. Edited for clarity. Story 10, not a doctor, but my mother is so. I heard all the stories while growing up. Here are a few things that annoy her when arriving late to your appointment. If you arrive late, and she's already behind and seeing the patient after you, she may ask you to reschedule if it's not an emergency. If you know you're going to be late, call in and let them know it might save you a trip if the doctor is already behind, or they could tell you to come in anyway. 2. If it's your first appointment, try to arrive at least 15 minutes early. There's going to be paperwork. 3. It's obvious when people come in just looking to score some opiates or pain medication. It's sad, and she wants to help, but most all of those people are just looking for drugs, not help. For if for some reason you do not want a female doctor, you should tell the scheduling people when you make your appointment. It's happened a few times where a man would come in and not allow her to touch him due to religious restrictions. You just waste everyone's time with that. 5. Don't just stop talking your meds, because you start to feel better. Oftentimes the meds are what makes you feel better. So if you stop them, you'll be back to square one. Some meds need to taper down, so it can be dangerous to go cold turkey. 6. If you do not speak English or are calling in for someone who does not know English, please let the staff know when they schedule the appointment. The clinic is required to pay for an interpreter for you. If they show up and cannot communicate, there is not much that can be done. If this is the case, please show up, because they have to pay the interpreter even if you don't show up. 7. Pay your bills. The billing department will work with you. If you have a certain number of unpaid bills, you will not be seen. Some guy once hired one of those services that claimed to reduce your medical bills by negotiating for you. That sort of thing only really works with hospitals where you don't have recurring visits. The hospitals might settle for getting a lower amount rather than getting even less by selling it to a collection agency. But a clinic that you have to go back to every 6 months will just fire you as a patient. Don't be the doctors and nurses are doing their best to help you and deserve respect. They do not have to see you, so don't go treating them like some minimum wage cashier. You should also treat cashiers with respect and try to walk all over them. My mother has fired patients who were repeatedly rude to the front end and phone personnel. There is a section in your account where the staff can put notes for everyone to see when they pull up your billing info. If you're to them, it will show up there, and you'll find everyone much less accommodating. Story 11. Physical therapist here. When this conversation happens, patient, you made my back pain worse. Me, oh no. Which home exercise aggravates your pain? Patient, I didn't do them. Me, okay, then what did make your back pain worse? Patient, I have no idea. Me, what did you do yesterday? Patient, well, I felt better after you examined me. So I played golf for 6 hours yesterday, went to roller derby practice, helped 3 friends move, ran a half marathon with no training. And now I feel worse. Me, facepalm. Story 12. I'm currently a medical student, but this really bothers me. If I'm taking your history, don't lie to me about what you're here for. Even if it's embarrassing, you're just wasting the doctor's time when they have to take a completely different history from the one you give me. And I'm inputting your charts anyway, so you're not hiding it from me. Edit to clarify, I'm talking about a situation like this. Meet a patient. Hi, I'm a med student, and I'll be taking your history today. Patient, to me, I have a sore throat. Maybe I have strep. Meet a patient. Okay, let me discuss your symptoms with the doctor, and he'll be back to perform your physical exam as soon as he is able. Meet a doctor. Patient thinks he has strep. Patient told me this info. List symptoms patient gave me. Doctor arrives. Doctor to patient. So you think you have strep? Tell me more. Patient, actually, I think I have crabs. This has happened twice in the past 2 years, but it happened on Friday, and that's why it was on my mind. This complaint is not about patients being embarrassed or not want to talk to the med students. It's about literally lying to me and wasting time. Story 13. Belittling their G's family doctors. I'm not a GP, but they don't just deal with colds and gastro. If the GP misses your DVT, you could die. If the GP misses your bowel cancer, you could die. If the GP doesn't treat you for community-acquired pneumonia, you could die. If the GP doesn't realize that your headache is actually meningitis, you could die or be left with brain damage. And what is there to belittle? GPs in Australia can make at least 35 for 2 minutes of work. That's all it takes to sort out a sick note or a flu shot. Story 14. The eternal paradox of demanding all of the physician's time for themselves while expecting him to tend to others quickly. Did you waste 15 minutes of your consult shuffling papers or going on about unrelated stuff? Take a look at the next person going in as you walk out of the consultory. That's also your time you were wasting. Story 15. As a doctor, I really have to add in that a lot of these comments bother me. The last thing the big portion of these patients need is another reason to be scared of going to the doctor. Personal judgment from the doctor. If the patient came in with what you consider a low-level reason, take the time to educate. That is at least half the reason any patient is there, and they appreciate it. Ask yourselves if you enjoy going for medical dental visits yourself. I don't. It can be a vaguely embarrassing, invasive, a humbling experience. Though I do appreciate the value of being educated again of what it's like to be a patient. While I don't see it often, there is one thing that annoys me about patients, though I wouldn't express it to them. Anyone who defends cigarette use as something more natural, relatively innocuous. I had the aunt of a pregnant teenage patient rhetorically ask me if quitting smoking would cause a shock for the baby and therefore be harmful for the pregnancy. It was clear from the tone that she thought the girl should continue to smoke. Another wanted only natural medications, vitamins during the pregnancy, no vaccines, fully natural childbirth with no cord cutting, all of which I'm fine with for the record, but continued to smoke 12 ppd during the pregnancy. To all smoking pregnant preconceptual patients, I say for the grand majority of pregnancies, up to the point the child is born, you quitting smoking is more important than anything I can do as a doctor, and I will gladly help you in any way I can towards that goal. Story 16, not a doctor, but I work as a technician for a dentist. Whenever a patient says, I'm planning to go to insert a place ridiculously far and permanent trip out of the country in 2 days, please get this done by then. When that happens, you're basically asking for a job. There's a good chance whatever work you are getting won't fit properly or may crack break in a few months. Besides the obvious rush mentality that gives the result a risky conclusion, it's also because you give very little option to the dentist to do try-in appointments. The try-in phase is very important and a good investment to ensure that your restoration will turn out good. To compare, what you're basically doing when you ask for something in 2 days is you're completely skipping the test drive and just buying the car off of what you know from specs and then expecting to be satisfied with it. Be kind and give your dentists and technicians a good minimum 4 to 5 working days for low-unit jobs, i.e. single crown, denture flipper, and 8 to 12 working days for high-unit jobs, full mouth restorations, multi-unit crowns and bridges, implant work for each part of the phase. Story 17, this is the AskReddit I have been waiting for 3 years. As an ED doctor in the UK, here is my unfiltered rage. We are not a second opinion service. So you've seen your regular GP for back pain who has organized you an MRI in a few weeks' time. Likely it's several £1,000s expense, but because you tweaked it this morning, lifting some, you think that you're now in need of emergency scanning and referral. Not happening unless you physically can't move that leg, or you've been shitting yourself through your now flaccid but whole. I'm going to send you home with paracetamol and rehab advice. If you ask nicely, you might get some codeine. Oh, and we don't like it when you've been to another emergency department and just don't like what they've said to you. And don't misquote my colleague from that hospital. I'm liable to call them and get the dirt on you. Take your diarrhea and vomiting home to bed with you. I can't do anything about it, and you're using up our taxpayer-funded toilet roll while you wait 4 hours to be seen by me, to be told to mandelman up and GTFO, unless you plan on infecting me, in which case stop by. I get 48 hours off work if I get DV. You want a pregnancy test to Tesco, they're about 3. I've been having insert vague symptom for 1 infinity months, doctor. See your GP. It says accident and emergency above the door for a reason. If it's 4 a.m. and you came in with belly ache that has since got better in the waiting room, but yet you stay to see me, I am very liable to be shitty with you. You aren't a customer. This is a public-funded service. Behave. On the subject of behave, don't swear, shout, spit at, or intimidate the staff or other patients. There are other people in this world to consider you drunk spolthyself entitled. If you call an ambulance, you better be close to death or completely incapacitated. Every night, I see 20 or so people walk out of the back of an ambulance into the ED. You needed a taxi at best. No, we won't give you a ride home after I've deemed there's nothing wrong with you. I repeat, you are not a customer. I am a doctor, not your barista. I have a responsibility to steward our use of antibiotics. I use them every day to save lives, and I want them to continue to work. So yes, you're just going to have to it up and drink honey and lemon like the rest of us for your cold sore throat. What happened to people's ability to self-care at home? You will thank me next time you come in with septic shock and need effective antibiotics. Think bigger. This isn't just about you, and can't be when it affects everyone. I couldn't get a GP appointment for 2 weeks. Make the appointment anyway. If you feel better by the time it comes around, then cancel it. I'm not a GP. I cannot refer to anyone unless you are an emergency. And after seeing me, you will still have to make the GP appointment for your arthritic hip. 111 told you to come here within an hour. 111 is staffed by call center staff with minimal training and a script. I may disagree with their assessment. Your friend's drink has been spiked. No, she's just pissed. Shall be put with a bowl by the door, and when able to walk through it will be encouraged to do so. Take in speed unknown powder from a stranger in a club, and now feel anxious. It's almost like you took a illicit drug. Moron, someone's been seen ahead of you. This happens when they are sicker than you. We triage based on need, not neediness. 20 years old and have chest pain. Think you're having a heart attack because you lifted weights and now have a sore chest. To everyone else, to those people who are in critical need and very unwell, I'll be 100 there for you. I love my job, and I love helping people with the training I have been privileged to receive. It'll be empathetic and thoughtful and will break down concrete walls of hospital politics with my own balding head to help you as your advocate. But abuse the system we are blessed to have, then don't be surprised when I look unimpressed and send you out the door after a 5-minute consultation. Believe me, it's more than my job is worth to send home someone I have any concerns over. It's accident and emergency, not anything and everything. And for the public education, here is the NHS section on AE, and crucially, where you can go instead of doctor for the sake of this post. But pharmacist chiming in. Patient, I have a 2-year-old with a runny nose, and I found this homeopathic remedy that doesn't actually have any medicine in it. Is this a good choice? Me, well, there's no evidence to suggest that this product is effective, but this Claritin Zyrtec is not only cheaper, it has real medicine in it that has been clinically proven to help manage allergy-type symptoms, including runny nose, and is labeled for use in a child this young. Patient, no thanks. It'll just give this other, after wasting 10 minutes of your valuable time against your professional advice. Story 18, what's really frustrating in this thread is that I understand why some of those things would annoy doctors, but it's also turning people away. The best would be to have, like in a helpline to explain what's going on that would help you decide what to do. That way you don't uselessly clog services while still talking to a professional. Story 19, I'm a dentist, and we know most patients are pretty high anxiety, and everybody deals with that in their own ways. Sometimes it's talking a lot. Sometimes it's wincing even though nothing hurts. Sometimes it's even being mean to me or my staff. We get it. And that is why we spend time before any procedures explaining things and talking about anything you want. But what really annoys me is once we get going, I just need you to sit still and keep your mouth wide open. I am performing microsurgery on your tooth with a very sharp drill that spins at 300,000 RPM, and I need to make cuts to tolerances of 110 a millimeter in dark confined spaces in the back of your mouth. I'm sorry you don't like the feeling of your own saliva pooling in your mouth, but I just need you to it up for 30 seconds so I can do a good job, and we won't have to redo this in 6 months. Story 20, biomedical engineer and very sick individual here. For me, not wear their braces for doctors I've spoken to not take their pills when they die. Not a real doctor, but a dentist here. There are a few things that irk me, but I do realize that people really do not want to come to the dentist, so I try my best to ignore most of it. So the only thing I'll say without trying to toot my dentist horn here is that, believe it or not, a lot of the things we do in dentistry on a day-to-day basis are actually pretty difficult technically. The fact that we do it so often that it becomes routine does not change that. I realize that patients have no idea what I am doing in their mouth for the most part. But believe me when I say that mistakes within fractions of a millimeter can mean the difference between an amazing result and catastrophic failure. As such, when patients have either a bad attitude or are not interested in trying to help me, it adds a huge degree of difficulty to something that is already hard enough. People who don't open wide on purpose even after being asked, or keep trying to sit up and want to rinse constantly, or ones that try to grab my hand when I'm giving an injection or drilling. I'm not asking you to do or not do certain things solely for my own good. It's actually for your own good, so that I can achieve a great result for you in your dental work, and also so that I don't accidentally bury my drill into the side of your tongue or the floor of your mouth while you were squirming around. TLDR, be kind to your dentist, and try to make their job easier when you are in the chair. Even though you are a paying customer, the easier you can make it for them, the better quality dental work you will have in your mouth. Their main concern if they are a good dentist, and yours should be achieving a quality, long-lasting result for you. Story 21, when the question asks a specific group, example, doctor engineer, and you get a million not a doctor engineer people chiming in. I'm a doc. The worst is the patient that is allergic to everything except the medicine that they want, which is dilaudid most of the time. Story 22, when I ask the lovely 89-year-old woman to show me her leg, and she strips down fully, I wouldn't have minded too much if I wasn't crouched down at the time and came face to face with 89-year-old vagina. Story 23, honestly, showing up late to an appointment, I feel obligated to see them, and then my other patients end up waiting. Even if it's just 5 minutes, it adds up over patients, and it's tough to cut a visit short when you only have 20 minutes allotted in the first place. A patient can come to me with the most bizarre or trite complaint, and it won't bother me because I'm there to help them out, but I hate keeping my patients waiting as much as they hate having to wait. Story 24, I stopped taking my medication 3 months ago because my bingo buddy said it doesn't work. No, I didn't tell you because I thought you'd be upset. I want what's best for you. If you're not okay with the treatment, we can talk about it. Also, when said friend comes in and says they only use their daily mess once a week because it didn't work. Gee, I wonder why it wasn't life-changing. Story 25, the biggest thing for me is not being able to provide a useful medical history. Even if you don't know anything about medicine, you should know whether or not you have diabetes, high blood pressure, lupus, Same for medications, just write down a list and bring it with you. It's amazing how many people can't tell you how long they've had X symptoms, if they've ever had them before, etc. And no, I can't skip the questions and just look in the computer because the electronic records are often incomplete or out of date. I know we asked a ton of questions, but I promise they're important, and it's really hard to help you if you can't answer any of them. Story 26. As an emergency medicine doctor leaving against medical advice when they have something serious. I had a patient with a very large pneumothorax collapsed lung. He insisted that he knew his body and had to leave so he could sell his car. Another patient had a STEMI, the more serious type of heart attacks, and left against medical advice from the ambulance. Even had the cardiologist talk to him on the phone, essentially saying, if you don't come to the hospital, you'll almost certainly die, and still insists on not coming in. Heroin overdose patients that act like jerks happen so often. Patient will be passed out, not breathing, vomits, has pneumonia and multiple lung lobes on death's doorstep, but once you resuscitate them, all you get is a middle finger, literally get spit on, and sometimes they'll swing at you screaming. Not all of them are this bad, but so many of them are non-emergent complaints. Our emergency department gets full to the brim with patients. Wait times are long, resources are low. Some patients clog up that system with non-emergent complaints that should be dealt with in a clinic setting, not the emergency department. Medication refills, or their specialist appointment is too far away and they want to be seen by that specialist that day, or back pain they've had for 50 years that isn't any different today than usual. Overall, it's not bad though. A patient who's even a little appreciative goes a long way in making it feel worthwhile. Being able to actually reassure someone who was just scared over something small, or getting to make a positive impact in someone's life when they have something big makes it feel worthwhile between a lot of the jerks we encounter. Story 27. I feel so much better about staying home for anything less than 810 pain or an infection that lasts longer than a week. Doctors, am I doing the right thing by staying home with gastro as well? Story 28 say that they have a high pain threshold. No, you don't. You get to make this claim if you're giving birth while browsing Reddit, not if you scream and cry while getting your blood pressure taken. Story 29. Argue with me about vaccines. I don't care what you read anywhere. I have built, tested, and witnessed a vaccine in action with my own eyes through a microscope. They work, get over it. And even if they didn't or caused autism, or we those morons say, how is autism not the preferable choice to diseases that will kill your child and possibly other people's children? We went to school for a long, long time and know what we're talking about. Please trust your doctors. Story 30. Wife is a radiographer. She takes the x-ray pictures. It's all the people who just don't listen. Lie on your side does not mean on your front. Hold still means exactly that. By having to redo x-rays, people are getting extra doses of radiation. I cannot believe how stupid these people are from the story she tells. Story 31. Coming with a complaint and giving really vague answers to all questions. For example, me, when did it start? Patient, oh, it's been a while now. Me, how long is a while? A day, a week, a month? Coming in with extremely complicated tight clothing. Please assume that if you're coming in for a knee complaint that you're going to have to take off your trousers, shoes, and socks. Please don't wear knee-high lace-up boots or slip-ons, although each of these things only takes 30 seconds extra. If each patient has a few of these micro delays, that means that at the end of the day, I will be running an hour late. This helps nobody. Story 32. As a nurse lose there at me because they can't keep track of their medications and have run out and call it 5 minutes to closing on a Friday. I love receiving a bowl locking right before my weekend starts. Thanks. Story 33. Patients who don't use their screening opportunities. I'm in the UK, so it's all free, but so many people don't get their cervical smears or bowel cancer screening, mammograms, routine STI, and HIV checks, not just when you think you might have caught one. It's such a small part of your time and has the potential to save your life. Story 34. My mother is a doctor. She told that about once a month, patients try to sell things to my mother's office. They can be anything: insurance, secrets of Asia pills, etc. Some guys even preach in her office. Story 35. Not doctor, but former EMT. The final answer is lie. Lie to a healthcare worker is the most irritating and infuriating this people can do. Honestly, no one gives, but when you say your issue started 30 seconds ago, but it's been 3 weeks, it could be a very different potential diagnosis. Probably not the best example, but so many people lie to healthcare workers, you quickly become a detective to cope with it. Story 36. New patient, I need refills on my medications. Me, I haven't prescribed you anything before. What were you taking? New patient, Vicodin and Xanax. Me dash. Story 37. When patients tell me whether or not they need surgery, I didn't go through med school and all this specialty training to ask for your internet assembled medical opinion. I know patients like to feel involved and coddled and special, but save that for when you're giving birth. A lot of the comments in this thread are just cementing my opinion that doctors are kind of dicks. Read the oncology, dude complaining that cancer patients want to act normal and don't want to talk about the cancer that is killing them for once. Story 38, when they don't set their phones to silent mode, or even pick up or read a text message when I'm talking to them. It's disrespectful and tends to me taking them less serious. If your phone is more important than your health is right now, you probably don't feel that bad. Story 39, when I ask a question and they don't want to answer, I'm not here to get some gossip on you. I honestly don't care on a personal level if you do eat dog food, put stuff up your butt, well, like the smell of glue, but all that stuff that sounds either invasive or irrelevant to you can potentially be medically relevant. Case in point, something is out there as whether or not you eat grapefruit is medically important in certain situations. If you take certain drugs, it can negate the effect. Story 40, this happens all the time. Doctor, do you have any pre-existing condition? Old lady, no, I'm very, very healthy. Doctor, do you take any medication? Old lady, oh yes. I take this for my blood pressure, this for my blood sugar, this for my heart, this for my thyroid, etc. Story 41, here are a few that stuck with me the last 2 years. Case 1, me, hi Ms. Name. I see you're here for recent onset fatigue patient. That's Dr. Name me. Oh, what's your specialty? Patient, I'm a professor of anthropology. Me in my head. I don't care what your title is. I just wanted to see if you're a medical professional and would possibly mention things like noticing Trousseau's sign with the fatigue. Later in the visit, patient, I know it's adrenal fatigue. My friend takes something thyroxine and it helps her. Me banging my head against the wall. That disease doesn't exist and the med targets the wrong organ. Me, we need to do further workup. First case. 2, coming and yelling at the doctors and nurses with your lawyer grandson because you decided to borrow Viagra from your friend while you're prescribed nitroglycerin for angina. 4, non-med people, that's a deadly, deadly combo. We always give a huge clear warning and chart the patient's reaction understanding. The erectile dysfunction has to be treated with something like a pump or alprostadil, the injection that porn stars use. Story 42, my mother has worked as a biller for a doctor's office gastroenterologist for years. Some of the ones she comes home complaining about include, but not limited to, people telling her about their symptoms. She's not a doctor. Please save this for him, calling to complain about how much an office visit costs. Yes. Even if it is 20, she does not control this. There is not anything she can do about it. Bringing in stool samples to show her, yes, it really happens. Story 43, patient call in to ask for a refill. I look at the record, and it looks like they've had refills a few weeks ago. So I ask which medicine. They don't know. Typical responses include the doctor knows. All of them, the white one. Story 44, my aunt pediatrician hates patients who have zero medical knowledge. A mother came in with her son one day. He has these funny bumps going up his back. Are they dangerous? Face bombs, and points to the woman, the spine on a skeleton. Story 45, when they blame me or their other doctors when we cannot fix their health issue, especially with older patients, except for organ transplants. We are not auto mechanics who can just switch out old parts or faulty circuitry for new ones. Nature is the one trying to end your life. We are trying to prolong it and make it easier to bear. It's just that in some cases, try as we might, we simply cannot always do that. And for God's sake, take your medicine, or don't, but be prepared to face consequences for not doing so. Sure, the pills make you drowsy. The pills are also preventing your third and perhaps fatal stroke. They'll write you the prescription, monitor your response to the medication, etc. But being self-responsible and following through is up to you. I love my job, but there's a distinct faction of patients who don't want to take responsibility for their own health and look at doctors like we are the landlords of their bodies and responsible for its upkeep. In reality, we are more like contractors brought in to salvage what we can after a natural disaster. Story 46, not a doctor, but a patient. I feel doctors probably get annoyed when their patient lies to them about symptoms. I personally don't lie, but the doctor I encountered seemed like he deals with that a lot. I recently went into the ER a couple months ago for the flu. My father contracted it from someone at work, and I work on the same property as him. Anyway, I somehow contracted it from him because I started to show symptoms that he had. I didn't want it to get worse, and I felt okay for the most part, but knew it wouldn't stop. I went to the ER, told the doctor there exactly what I had, and he gave me this look as if I was lying to him. I told him why I believed I had contracted the flu, and he still didn't look like he believed me. He gave me the medicine for it anyway. And sure enough, the next morning I was nauseous and super dizzy and just couldn't do anything. Had I waited to go to the ER, it probably would have been much worse. Story 47, not a doctor, but I work in a pharmacy. The number one thing is people who say fill all my prescriptions, especially those with a ton of medications. I know you are supposed to be taking them all, but at least have the name of the medicine prescription number. I can't just fill 20 different prescriptions and not verify with you if you're supposed to continue taking them or not. Others, too, calling their doctor for a refill saying it's our job to give them emergency supply until their doctor approves. It's not really, we just don't want you to end up in hospital. Also with refills on most maintenance, doctors will write for a year or 6 months and want to see the patient annually or biannually. I've had patients complain and ask my manager when their doctor denies a refill. Seriously, there's nothing we can do if your doctor says no. 3 doesn't bring their insurance card but complains about a copay. Just because we're contracted with your insurance doesn't mean we have your information. Also calling them takes a long time.